So one of the important topics we selected today so that we can discuss a little bit how to approach and what kind of aspects that you would have to be looking at for, especially in child maltreatment. It is an appropriate topic for the current situation during COVID-19, where everybody is confined to home and parents are jobless or rather working from home situation. And there can be a lot of conflict and violence at home, leading to child maltreatment as well. So I would try to cover a little bit about the prevalence, the risk factors, types of abuse, the clinical features and identification, and how do you approach a child whom you suspect maltreatment. So over the past 30 years, children's lives have been transformed because more than 50% reduction in deaths, almost half less than undernourished, 2.6 million are protected with clean water. But still, there are several millions left behind because of the rapidly changing environment. Still, there are nearly 262 million children and youth out of school, more than 600 million girls who are getting married before 18th birthday, and 1 in 4 children with limited clean water access as well. So because of this, the Convention of the Rights of the Child was established, and there are mainly to safeguard and protect children from all these adverse events related to the environment and the society. If you look at the definition, child maltreatment is abuse or neglect that occurs to children under 18 years of age, includes all types of physical, emotional, ill treatment, sexual abuse, neglect, negligence, and commercial or other exploitation. This results in actual or potential harm to the child's health, survival, development, dignity, the context of relationship of responsibility and trust or power. So this is the WHO definition. I think it has changed over time as well. So this is what they use as the definition. So if you look at the prevalence of this, nearly 300 million children aged 2 to 4 years regularly suffer from physical punishment or corporal punishment or psychological violence in the hands of parents or caregivers. 1 in 5 women and 1 in 13 men are exposed to sexually abuse. 120 million girls and young women under 20 years of age suffered from forced sexual contact. So with that little prevalence, you can see, if you look at the trend in the prevalence, even though over the years it has drastically come down, still you can see there is a lot of static. It's come to a static level. So we need to bring that static value also much more down. If you look at the children's rights worldwide, according to the World Bank and UNICEF report, the green indicates the good situation, that there is good child rights and child rights promotions are encouraged in these countries. And if you look at the black spots, there's very serious situation where child's rights are impaired a lot. If you look at India and Sri Lanka, India is red. That means there is a difficult situation. But Sri Lanka is in the orange zone, which suggests that there is a noticeable problem in children's rights worldwide. So if you look at, I just want to show you the Northern Province data as well. This was a study we did it in 2016. So again, you can see just after the war, the 2009-10 where the war ended, and then suddenly you could see a surge in the all the prevalences except the one school dropout, the others all increased a little bit, and then you could see that they are coming down, and now it is almost manageable levels that was seen in the Northern Province. If you look at the demographic features, boys and girls both are abused equally. Firstborn is affected more. One is affected in a family of several children, and younger children are more vulnerable and they are affected more and more. The more they are younger, they are more encountering more of physical abuse rather than sexual abuse. Sexual abuse is more prevalent in girl child and in the adolescent group. And if you look at the death due to abuse, it's rare after 1 year. That is the demographic features. And if you look at the consequences of child maltreatment, there are several consequences, short term, long term, and also transgenerational consequences are also seen. So if you look at the short term problems, especially the physical injury, even though the injury gets scarring or maybe is healed without scarring, but the psychological trauma is so main that they can be sad and rejection and lot of emotional and psychological problems are seen as short term. And if you look at the long term problems, there are a lot of issues with the sexual abuse because the perpetrating or they become perpetrators and then being a victim of violence. They also have depression, suicidal thoughts. They can abuse themselves for smoking, alcohol, and drug misuse. High risk of sexual behavior and sexually transmitted disease, unintended pregnancy, and because of the stress and the severe trauma they are undergoing, there are changes that can occur in the bodily environment and can cause ischemic heart disease and cancer as well in long-term problems. Even though there are these short term and long term problems, transgenerational problems are also seen where the stress related issues are transmitted transgenerationally, and it is demonstrated clearly in several studies done over the world. The interesting or the other part that we need to understand is the socio-ecological model. So when you look at the macro system or the society, where society is prone to have poverty or there is violence in the society, the ecosystem or the exosystem where the community is also affected, thereby the microsystem, the family unit, parental disharmony and family unit is affected, that results directly as well as indirectly onto child maltreatment, which is manifested as sexual abuse, physical abuse, emotional abuse, and so on, or emotional neglect as well. Even though with this socio-ecological system, the violence, the acceptance of violence as norm in some of the societies we see, it has become norm. Abusing the wife or abusing a female person in the household has become normal and it is accepted in the society. So that is why the violence in the society has led to violence, domestic violence, and thereby it has contributed a lot to violence against children as well. So the violence in society is contributed by a lot of factors like freely available drug and alcohol, misusing them a lot, TV and movies, there are a lot of these dramas and films encourage violent behavior, media giving prominence to violence. Anywhere you see a murder or suicide, that is reported as headlines in the media. And then in the society, again, the microsystem, the family, they are having poverty or literacy, poor literacy rate, and again, there is more prone to get violence. And nowadays, we see quite a lot of these parenting skills. Lack of proper parenting skills and the parental guidance towards children is lacking, and thereby that also can lead to violence in society and domestic violence, and thereby lead to violence against children. So if you look at the risk factors that are more prone to cause child maltreatment, you look at the child factor, the under 4-year-olds or an adolescent is highly there is high risk, being unwanted or failing to fulfill the expectations of the parents. Again, we see quite a lot of these children who are facing exams or the scholarship or the GCO level. Their expectations, if the is not fulfilled, then that means there is a risk factor for them. And the children who have special needs or dysmorphic children, there is a high risk, and intellectual disability, neurological problems are also a problem. Even though the bisexual or transgender is a risk factor, but we don't see that in Sri Lanka until now. Probably in the future we may see that. And then there are certain factors, the parent or caregiver factors. Difficulty in bonding with the newborn. If the child is premature and has been put into the NICU, then the bonding is not seen. They have been maltreated themselves as child. There is lack of awareness of child development and also having unrealistic expectations. They themselves are misusing alcohol or drugs, including during pregnancy. But we don't see that here, but in UK and other countries, you may see that. Poor impulse control and low self-esteem, mental or neurological disorders involved in criminal activity, and having financial difficulties also are risk factors in the parent or caregiver. So if you look at the other factor, the relationship factors. So relationship factors, if there is family breakdown or violence, as I said earlier, being isolated in the community or lacking support network, breakdown of supporting child rearing from extended family. So when there is an extended family, obviously, you feel that there is a kind of protected environment. There is a lot of support from these grandparents. And then the society, of course, the society also plays a significant role in child maltreatment. So what are they? If there is gender or social inequality, now you see after this Afghanistan, there are again a lot of problems due to the gender issues. So social inequality, lack of inadequate housing or services, unemployment, poverty, easily available or easy access to alcohol and drugs. And also the government, when there is lack of policy or program to prevent child maltreatment, social or cultural norms that promote violence, and of course the policies that involve social, economic, and health and education. So these are some of the risk factors that we need to be aware of, because when a patient comes in, these risk factors are there. We have to have a awareness that this may be due to a child maltreatment. So the perpetrator, the person who inflicts the maltreatment, is usually the child's parents. They may be young themselves, teenagers or adolescents. Their parent abused as a child. There's 20 times more likely that the parent was abused. But still, sometimes you encounter a few parents who overprotect their children because they were abused as a child, so now they have trying to overprotect their child. Both parents can be involved, especially in physical or neglect. Sexual abuse is usually by men. Munchausen proxy, where the women inflict injury by poisoning, suffocation, and so on. There may be no mental illness, but personality traits, violent behavior, inappropriate sexual behavior, some of the features or issues that the perpetrator may have. But it is common in the poor socioeconomic, all society levels are also having this type of problems. It is not only in the poor, it is also seen in the rich as well. So I have put this as adverse childhood experiences, even though child maltreatment directly involves these four that is marked in red: the sexual abuse, physical abuse, emotional abuse, and neglect. It can also be an indirect or indirect extended Where indirect means bullying, parental violence. They are observing, looking at violence, looking at people misusing alcohol, looking or having an experience or exposure to parental divorce, maybe parental suicide and self-harm. Indirectly, also they can get harmed by or adverse experiences are seen because of poverty or community violence. Sometimes you may see this political upheaval or economic upheaval, especially in war or conflict zones, that also may indirectly affect the adverse events or adverse experience to these children. So if you look at one by one, if you look at the sexual abuse, this is usually occurs in a dependent, developmentally immature children and adolescents who participate in sexual activity. They usually do not have an understanding and they are unable to give informed consent, which includes fondling, masturbation, external genitalia contact, and intercrural intercourse. That is non-penetrative or like that. Penetrative injury can be due to oral, vaginal, and anal, where they can have tears and so on. Participation in pornography, videos, network abuse, sexual rings, ritual abuse, indecent acts. Usually nowadays you have to be very careful, especially when they are using a lot of this internet to use as educational tools. And sometimes parents may not be aware that these children are giving their information, phone numbers, emails to these unknown person on the other side. That person can ask, take a photograph and send, and that also will be like a cyber crime or cyber abuse, where you may be indirectly part of pornography and videos through this networking. Sri Lanka is heading towards that problem. I think you would have heard some time back how a child was sold and bought and sold by several people online. So these are some of the sex rings that go on, which parents should be aware of and try to take preventive or precautionary measures. So if you look at the study we did, we also found that majority of the time it was sexual abuse, and perpetrator was known to the victim in 86% of the time. And of course, 70%, nearly 247 victims indicated that the perpetrator coerced the victim into a relationship before abusing. So this is what we usually see in these 13, 14, 15-year-old girls going out with a little 18-year-old or 19-year-old male who coerces the child or the girl into a relationship, and then he abuses the girl. So that was the common reason in our study. So if you look at the physical abuse is a spectrum. All occur as an act of hitting. Can be mild form due to corporal punishment or mild injuries like bruising, severe laceration to cuts and burns, more severe becoming fractures, and then of course it can cause lethal as well, causing death in these children. Most of these physical abuse may not leave a physical scar. They heal without any obvious physical scar, but they leave an emotional scar. So you can see not only the emotional abuse, the physical, the sexual, and the neglect also lead to emotional abuse or emotional scarring of the mind of the child. So you have to be very careful when you're managing these children because of the emotional aspect that they can get affected. So physical abuse can be due to soft tissue injury, burns and scars, and may mostly short term, and it may be repetitive as well. Long term can be due to suffocation or poisoning. So these are some of the photographs showing the external injuries: hitting, burning, bruising, incense stick burns are some of the injuries that we have seen in the literature. And also, if you look at the burns and scalds, it can be either an accidental burn or a child has been neglected. Parents are not aware, and he or she kind of goes and touches the fire. The fireplace is not protected, and so on. So that comes under the neglect. Or then it can be deliberately inflicted, as in case of abuse. So 10% of the physically abused children can have burns and scalds. Accidental burning peak is 2 years, deliberate burning then of course 3 years onwards. So these are some of the burns that you may see, scalds due to hot water and contact dry burns by burning from a iron rod or their incense or cigarette burns from flames where you can get charred skin. Then, of course, yes, cigarette burns, electric burns, friction burns. There can be chemical or radiation burns are seen as physical abuse. So this is another, you can see the cigarette burn, and if it occurs in nice circumscribed manner and on the back, so obviously you need to think of abuse. Burns like these where you may consider an accidental burn where the hot water has accidentally spilled over the child. So in this situation also you may have to investigate a little bit because that can come under the neglect component as well. These are another inflicted injury where it is clearly shown there's some mark. You may wonder, this is like that car cigarette lighter. It is seen in the car where you can charge your phones as well. So that actually has a lot of heat in it. So those are the marks that you can see in this case. So if you look at this case history, it's a 6-year-old boy seen at the A&E with swelling of left elbow joint. Gives a history of fall 2 days back with pain and swelling. On examination, there was limited movement and the swelling was at the elbow joint. The parents are divorced and the mother lives with the maternal uncle who is strict and also uses alcohol. So you can see the deformity of the elbow, and if you look at the x-ray you will see clearly the bucket handle type of fracture of the metaphyseal fracture you commonly see. And when you see this, always remember that you have to suspect a child abuse. So these are some of the fractures that you have to think of when you're considering child maltreatment, especially in the lines of physical abuse. A single fracture with multiple bruising, multiple fractures in different ages, and sometimes no bruising or soft tissue injury, rib fractures, formation of new periosteal bones, skull fracture in association with intracranial injury or multiple skull fracture, scapula and sternal fracture. And if the child has not presented on time for a fracture previously, then you have to suspect that it could be child maltreatment. These are some of the x-rays that we were able to use. So this you can see where the twisting of the limb can happen with small infants. Actually, they can break, even large bones can break because of firm twisting. And then you can see the rib fractures in the other x-ray as well. So you may confuse with these ones are common with resuscitation, but of course you have to look at the history again so that you can see that it may be due to child maltreatment. So if you look at the metaphyseal epiphyseal fractures, there are a few types that you have to think of. Corner or bucket handle fractures or chip fractures. And usual sites are the elbow, knee, wrist and ankle. They are usually asymptomatic and heal without callus, often multiple. So if you look at these photographs, you can see this is clearly a bucket handle fracture. Again, you can see a tiny chip there, that is a bucket handle long one. But here, this is a corner or chip fracture where only part of the metaphysics is, or rather the epiphysis is affected. So then you will think that it could be a metaphysical fracture compatible with child maltreatment. Periosteal reactions and multiple linear skull fractures are also part of child abuse. Again, a skull X-ray to show the linear fractures. So this is another case history that we had a girl who was referred to the pediatric team by the surgical team following further evaluation of left femur fracture. The mother gave a history of trivial traumas falling from a stool. Previously also the child had a fracture at the age of 6 years at the same place and plates were inserted by the orthopedic team. She had a surgery again for malunion of the bone. At the age of 8 years, between 6 and 9 current admission, at the age of 8 years there was a fracture of the right humerus but healed on its own. Neonatal history and the infant history were unremarkable. Repeatedly, so obviously this child was referred to us because the orthopedic surgeon felt it was something related to non-accidental injury. But we went on, we also had, before you label somebody of non-accidental injury, you have to thoroughly investigate, and proper history taking is very important. So repeatedly we had to look at the social history, asking about the background, who else is there, and so on and so forth. We sent the social worker to look at the home and assess the home situation. There was no risk identified. And then we did the x-rays and bone scans. Obviously the x-rays had multiple fractures. Bone scan also showed some diffuse density problem was there. So the diagnosis was made as osteogenesis imperfecta. So here again you will wonder that this type of injuries can mislead us and make us think twice. So in case if he had labeled that patient as child abuse and took action, the family would have got devastated. So anyway, always remember that we have to thoroughly investigate whatever before you label them as having non-accidental injury. So the clues that we got was the social history and the report of the social worker were good. Mother was very cooperative and she understood our problem, and that is how we made the diagnosis, and the child is currently on famindronate and is reasonably doing well. So these are some of the differential diagnoses you should be aware of that can confuse us a lot with child maltreatment. So head injury can be also due to accident or a non-accidental. And if you look at the non-accidental one, the acceleration, deceleration, which is seen with the shaken baby syndrome, is one of the crucial ones that you have to be aware of. So this is again a case history. You can see the 9-month-old baby is brought in by the uncle as the child was unresponsive and had a generalized tonic-clonic seizure. He also reports that a child fell off the bed 2 days ago and banged the head. The parents are both working and the little boy spends a lot of time with the uncle. On examination, you see the child is not moving the right side of the arm and leg, and there is deviation of mouth to one side. Examination of the eyes shows subconjunctival hemorrhage. The uncle was smelling of alcohol and wanted to go home, leaving the child in the ward. So this is a clear case of shaken baby syndrome. So obviously this is how when they are crying and irritable, you get irritated. Even us sometimes when they are so irritating and annoying, you would like to shake them. So when you shake them, then you see the acceleration, deceleration injuries, and inside the brain there is a lot of trauma due to speed. So risk factors are there to suspect a shaken baby syndrome. Under 1 year, between 6 months and 1 year, male babies, they are crying or they have quite a lot of infantile colics. And that's the time you get irritated as well. Preterm babies, very low birth weight babies, maternal depression, lack of understanding of the infant development. And in addition, there are a lot of other socioeconomic factors like low income, social isolation, lack of social support, parental care during pregnancy is poor, diminished marital satisfaction, and poor family functioning are some of the risk factors that will promote the shaken baby syndrome. The final one about the physical abuse is the corporal punishment. This happens either at home or at the school or in the community where you deliberately inflict physical pain, discomfort, or even psychological humiliation. Sometimes you scold those students, teacher-student interaction where you can see these kind of problems. So there are a lot of legislations that have been passed in Sri Lanka regarding corporal punishment. But the sad thing is none of them have passed through the cabinet to establish as legislation or the rules. So there are some loopholes in managing this corporal punishment. So this is another scenario that I would like you all to understand. The case of a 3-year-old boy brought in by the grandmother, third child of family of 5, 2 elder siblings, both are going to school. The two younger children are at home with the mother. Examination, you see a dirty, shabbily dressed and uncut hair, height less than 2 standard deviation, weight was less than 3 standard deviation, was noticed to be pale, had glossitis. Respiratory system, apart from few scattered creps were heard. Father is a mason, it's about 200 rupees, but mostly lives at his mother's house for employment. The child's mother also frequently goes to do odd jobs to support the family. So very clearly you can see a poor socio-economy and large family, growth faltering, and obviously this is a case of neglect. And if you look at the CHDR, you can see there are places where there have been serious problems in the weight of these child. So in such situations, you may try to remove these children or give them a support where you can provide financially or socially some employment, some kind of security. Then you may see some weight gain after support that has been provided for this family. Even though it has not reached the top, there is some improvement is seen with the support system. So if you see a case of neglect, then there are several presenting features that you have to look, and it may vary from infant to preschool to school to adolescent. So in that situation, growth faltering, physical changes, developmental changes, and behavioral issues can be presenting. So physically, they may have growth faltering, recurrent or persistent minor infections, frequent hospital admissions such as like that, and developmentally they may be delayed. Behavior problems can also be seen in infants as attachment problems, anxiety avoidance, and lack of social response. Preschool and school children also have physical problem, developmental problems, and behavior problem. School children, you will see more of learning issues are seen with poor coping skills and poor self-esteem. Whereas in preschool, you will see them having loss of attention, language problem, emotional immaturity, and so on. Behavior also you can see in the early preschool age, they are more overactive, aggressive, but then when they become school, they become self-injurious and relationship with others is affected. The similar thing, if you look at the adolescent age group, they may have attempted suicide, they may run away, and they can be alcohol or drug misuse can be seen. Promiscuity and delinquent behaviors are seen with the adolescent age group. Emotional abuse is the other one that you have to consider here. A lot of children can get abused like this, which do not come to light, and they may be having it inside themselves, and that can cause a lot of psychological problems. So emotional abuse can be continually ignoring or rejecting the child, physically isolating the child, forcing the child or doing things to scare them, exposing them to domestic violence, criticizing, humiliating, blaming, yelling, swearing, screaming at the children, and make the child feel different from other family members. You are worthless, you are annoying, you are not clever, you are dumb, like that. If you keep on doing that, unloved feeling, no attention, no praise to these children, bullying, teasing that can happen, especially in school by the peers and classmates, belittling, you have an abnormal face, your face doesn't look, your hair is not good, like that kind of bullying also can happen and cause emotional abuse to these children. Having unrealistic expectation, that is the other most important thing. Now parenting problems are the unrealistic expectation. Low IQ children are affected more because of these unrealistic expectations. And not allowing a child to explore, express themselves, make friends and so on also can create emotional problems. So how do you approach this type of problem? So up to now we were looking at the clinical features and so on, and the types of abuse and how you should be aware of the risk factors and see whether you can identify those risk factors to approach these children or suspect these children. So when you look at the approach, there are things that you should be doing first at the OPD or first contact level. So there are a few questions you may want to ask, and if the answer is no to these questions, then definitely there is a suspicion of child abuse. If the injury is compatible with the history and corresponding to the age of the child, if the answer is no, then obviously you have to suspect. Delay in seeking medical advice. If the answer is yes, then you have to think of child abuse. History is consistent when repeated. Then if the answer is no, then you have to think. Father, mother, and the child appropriate behavior and interaction, no, you have to suspect. Parents took adequate measures. If the answer is no, then you have to suspect the child abuse. So in an OPD setup, the medical officer or the person who is at the front of frontline service, you would be asking these 5 questions. And if the answer is no for 4 questions and yes for 1 question, then obviously you have to start the process. The reporting system has to be started for child maltreatment. So once they come into the wards, there are a few things that we should be doing. So as we said earlier, you have to take the history thoroughly, do a thorough examination. From head to toe examination is very important. And then the most important thing is note keeping. All injuries have to be measured and marked in body diagrams, body charts, and then you may want to take photographs with the appropriate consent. These can be shown as evidence in a court of law. So better to have another person during the interview so that if there is less chance that you may miss anything. And then you have to have the case conference. Now there are 2 types of case conferences that are advocated here. One is the clinical case conference and then the institutional case conference. Both case conferences are multidisciplinary. They have to involve the police and the GMO. And then, of course, the probation department will start the child protection measures, whether to put the child, remove the child from the home and put the child and the parent or whoever into the safe house, or restriction order or whatever. And other most important thing is the mental health of the victim, counseling the victim and making sure that there is no re-victimization. That is why we have these multidisciplinary case conferences. I'll come to that in a minute. How we to prevent re-victimization, and of course the counseling to the family is also important. So investigation wise, you will do certain investigation. If you are thinking of bruising, definitely coagulation screen has to be done with full blood count, blood film and platelet function to avoid an organic cause for the bruising. Skeletal survey may be repeated in case of to see the healing process, but we don't do that quite a lot nowadays because of the exposure to radiation. But in children who are less than 6 months, you would definitely want to do a CT brain and eye examination because of the risk of shaken baby. If they are more than 6 months, only CT is required if there are neurological signs. But eye examination has to be done to detect retinal detachment, which is also associated with shaken baby syndrome. So this multisectoral management objectives are to provide immediate medical care and secure the environment. So if there is a fracture, you have to reduce it and plaster it and so on. Reduce re-traumatization or re-victimization. And then the psychosocial rehabilitation, which has to be ensured, and assess other children. That is one of the key issues we have to think is one child is abused, there is a risk that other children also can be abused. So that is why we need to be very careful. All children have to be assessed. And also you have to work towards a holistic care, prevent further abuse and assist in the legal process for justice. So these are the people whom you would contact, the medical personnel who will be involved in curative and preventive, especially curative because of the acute management of the injuries, preventive in the side of primary prevention where you will make awareness programs, we conduct awareness programs, especially in MOHS, and try to create an awareness so that the parents are aware, or parenting skill workshops where you teach them how to encourage children. And then the legal and the social workers also are involved in the sectors that are involved in child maltreatment. So in case of a clear case of an abuse, the first thing will be you conduct this clinical case conference, right? So you have the victim and then you ask your pediatrician, psychiatrist, surgeon, obstetrician to sit together and work and come to a conclusion. In that point, the MLEF has to be issued to the police, and then you have to involve the forensic or the JMO as well. So this is called the clinical case conference, right? Clinical case conference, you will see it should also involve the psychosocial component, the police, and also the child right promotions and the child probation officers also should be involved in these case conferences. So if you look at the clinical case conference, there are 3 people will be mainly involved, the pediatrician, psychiatrist and the JMO. The main idea is to re-victimize, prevent re-victimize. Say for example, if you are the pediatric registrar, you will take the history and then you will refer to the forensic specialist, he will again take the history and then they will refer to the psychiatrist. That person also takes the history again. So this child has to tell the same story. Maybe if the SHO is seeing, the registrar is seeing, the senior registrar sees, the consultant is like that, there are several people may see for the same reason. So that is why nowadays we say these clinical case conferences mainly to see minimum re-victimization. So people can sit together, or either you do that or video the interview so that you don't get the re-victim person to tell the story again and again. Then that causes more and more problems. So the institutional case conference is the next step where you suspect the case of child abuse, and then you involve the police, the probation officer, and the child rights promoting officers. So this is again, you have to make sure that you don't re-victimize them, prevent stigmatization, ensure the safety of the child and family. Most of the time you will see sometimes when these girls go coerced into a relationship, has been abused, they run away from home, and then when they are brought back, the parents are so keen to remove them from the current schooling. So that, how do you ensure that their education is continued and uninterrupted? So they keep at the home, they don't send these girls to school. So obviously schooling can get affected. So you have to make sure that the education is uninterrupted. And obviously the psychosocial rehabilitation and reintegration, where you have to make sure that they are counseled properly to live again normal life and not stigmatize them. The social problems are sometimes, you see, these people, they like to talk. So that is one reason the parents want to remove these children from school. So that is why the psychosocial rehabilitation and reintegration is very important. And then obviously the legal justice has to be ensured, and the perpetrator has to be arrested or punished, but it all has to be done with minimal delay. Patients should not stay in the ward for a long period. So this is just to show you how the institutional case conference happens. So here, one in the pink, you will see the medical aspect where up to now I spoke about. Then you can see the social welfare also is happening. So what is that mainly? Whether you want to put them on safe houses, whether you want to put them into foster care, whether you want to put them into children's home, like that decision is based on the social workers report. So institutional case conference also involves the probation officer, the child rights promoting officer, NCP or National Child Protection officials, the hospital director, and whoever is helping in the placement. So those are the issues that have to be ensured when the child is going back home. And then the third, etc., is the police and the courts and the magistrate system, the legal problem where it is a punishable offense. So that is why you have to make sure that they are also handled properly. So this is the guidelines I thought you should know. It is a multisectoral approach. It is from the Sri Lanka College of Pediatrics, but I was unable to download it from the SLCP site. But it is available on the net. It's a PDF version is there, so please go read that. It gives you a good idea of how to go about approaching, how to detect it, and what you should be doing as registrars and senior registrars. So let me conclude saying that all children, whoever they are and wherever they are, must be protected.